it's important that women understand that if they're going to have a surgery like this, which is unfortunately considered cosmetic, labial reduction is stems from being a candidate.
Imagine going into surgery expecting one medical procedure, only to wake up and later discover that another procedure had also been performed, one you say you never agreed to. That's the experience actress Brooke Shields has publicly shared in her memoir and interviews. Her story has sparked conversations around the world, not simply because she's famous, but because it raises a question that affects every patient. How important is informed consent in healthcare? Today, we'll explore Brooke Shields' story, explain what the procedure involved, discuss why informed consent is a cornerstone of ethical medical care, and share what every woman should know before undergoing any surgery. Welcome to Health a Woman, where we break down women's health stories using science, medical ethics, and reliable information, not gossip or sensational headlines. If you enjoy evidence-based women's health content, consider subscribing so you don't miss future episodes. Let's begin. Who is Brooke Shields? Brooke Shields has spent decades in the public eye as an actress, model, author, and advocate. Recently, she has also spoken openly about women's health, aging, menopause, and the importance of women feeling informed and respected when receiving medical care. In her memoir, Brooke Shields is Not Allowed to Get Old, she shared a deeply personal experience involving surgery and what she says happened afterwards. Her story has encouraged many women to ask important questions about communication, trust, and consent in healthcare. According to Brooke Shields, she underwent surgery to address discomfort caused by her labia. She has said that after the operation, she later learned her surgeon had also performed an additional labia reduction procedure, also known as labiaplasty, without specifically discussing or obtaining her consent for that additional step. Brooke has described feeling shocked and violated. Importantly, her concern was not that labiaplasty exists or that women shouldn't choose it. Her concern was that the decision was made without her informed consent. That distinction matters. Because in healthcare, consent isn't just paperwork. It's a conversation. What is the labia? To understand the story, let's first understand some anatomy. The labia are folds of skin that form part of the external female genitalia. There are two main parts: the labia majora, the outer folds; the labia minora, the inner folds. Just like noses, ears, or hands, labia naturally vary in shape, size, color, and symmetry. There is no single normal appearance. Many women worry that theirs look different, but variation is completely natural. What is labiaplasty? Labiaplasty is a surgical procedure that changes the size or shape of the labia, most commonly the labia minora. Some women choose the procedure for cosmetic reasons. Others seek it for medical or functional reasons, such as chronic irritation, discomfort during exercise, pain during intercourse, or difficulties caused by enlarged labial tissue. Like any surgery, labiaplasty carries potential risks, including infection, bleeding, scarring, changes in sensation, or dissatisfaction with the outcome. Because it is a surgical procedure, informed consent is essential. What is informed consent? Brooke Shields' story brings attention to one of the most important principles in medicine: informed consent. Informed consent means a patient should receive enough information to make a voluntary decision about a proposed treatment or procedure. That usually includes why the procedure is being recommended, the expected benefits, the possible risks, available alternatives, what could happen if no treatment is chosen, the opportunity to ask questions before agreeing. Consent is not simply signing a form. It is about understanding what is planned and agreeing to it freely. Healthcare providers also have ethical obligations to communicate clearly and respect patient autonomy. What every woman should know. Whether you're having a minor procedure or a major operation, it's okay to ask questions. Before surgery, consider asking, what exactly will be done? Will there be any additional procedures? Are there alternatives? What are the risks and possible complications? What will recovery be like? Will anything change if unexpected findings occur during surgery? If something isn't clear, ask for clarification. You deserve to understand what's happening to your body. Being informed isn't being difficult. It's being an active participant in your own healthcare. Brooke Shields' story isn't just about one woman. It's about a principle that protects every patient, the right to informed consent. Regardless of the type of medical care you receive, understanding your options and being involved in decisions about your body is a fundamental part of respectful healthcare. Open conversations like these can help women feel more informed, ask better questions, and advocate for themselves with confidence. What are your thoughts on informed consent in healthcare? Have you ever felt that you didn't receive enough information before a medical procedure? Share your thoughts respectfully in the comments. If you found this video helpful, subscribe to Health a Woman. Science-backed women's health every week. Your body is not broken. It is just waiting for you to understand it.